Bacterial vaginosis is a vaginal condition that results from an overgrowth of normal bacteria in the vagina. The condition was formerly referred to as Gardnerella vaginitis, after the bacteria that were believed to cause the condition. However, since there are a number of species of bacteria that naturally live in the vagina and can grow to excess, or imbalance to cause the condition, the name bacterial vaginosis is the preferred term. As a result of overgrowth of certain bacteria, a vaginal discharge may result. In the past, the condition was called Gardnerella vaginitis, after the bacteria that were thought to cause the condition. However, the newer name, bacterial vaginosis, reflects the fact that there are a number of species of bacteria that naturally live in the vaginal area and may grow to excess, rather than a true infection with foreign bacteria, such as occurs with many sexually transmitted diseases, STDs. The Gardnerella organism is not the sole type of bacteria causing the symptoms. When these multiple species of bacteria that normally reside in the vagina become unbalanced, a woman can have a vaginal discharge with a foul odor. What causes bacterial vaginosis? The reasons for overgrowth of certain types of bacteria in the vagina or an imbalance in the growth of these bacteria are not fully understood. However, certain factors can increase a woman's risk of developing bacterial vaginosis, including having multiple sex partners, having a female sex partner, tobacco smoking. Vaginal douching also may increase the risk of developing bacterial vaginosis. While the condition is more common in women with multiple sex partners, it is not believed to be contagious or entirely related to sexual activity since it is the result of overgrowth or imbalance in the bacteria normally present in the vagina. Moreover, women who have not had sexual activity can develop bacterial vaginosis. How do you know you have bacterial vaginosis? Many women with bacterial vaginosis have no signs or symptoms at all. When symptoms do occur, the most common include an abnormal amount of vaginal discharge. It is difficult to determine how much discharge represents an abnormal amount, since all women can have varying amounts of vaginal discharge. In general, any discharge that is in excess of normal for a particular woman can be regarded as abnormal. The vaginal discharge is thin and grayish-white. Vaginal odor, foul-smelling or unpleasant fishy odor. The vaginal discharge and odor are often more noticeable after sexual intercourse. Pain with sexual intercourse or urination, rare symptoms. Symptoms of bacterial vaginosis, if present, can occur any time in the menstrual cycle, including before, during, or after the menstrual period. What causes bacterial vaginosis, BV? Researchers have had difficulty determining exactly what causes bacterial vaginosis. At present, it seems to be that a combination of multiple bacteria must be present together for bacterial vaginosis to develop. Bacterial vaginosis typically occurs when a reduction in the number of the normal hydrogen peroxide producing lactobacilli in the vagina. Note: these normal hydrogen peroxide producing lactobacilli act like the good police ensuring health safety in the vagina area. Simultaneously, there is an increase in the concentration of other types of bacteria, especially anaerobic bacteria, bacteria that grow in the absence of oxygen. Why the bacteria combine to cause the unbalance is unknown. There are things that increases the chance of developing bacterial vaginosis. For example, multiple or new sexual partners. IUDs, intrauterine devices, for birth control. Recent antibiotic use. Vaginal douching. When a woman washes or flushes the vagina with water, vinegar, apple cider vinegar, baking soda, or iodine. Is bacterial vaginosis an STD or yeast infection? Bacterial vaginosis is not the same thing as an STD or yeast infection. Any woman with an unusual discharge should be evaluated so that more serious infections such as chlamydia and gonorrhea can be excluded. Symptoms may also mimic those found in yeast infections of the vagina and trichomoniasis, an STD. And these conditions must also be excluded in women with vaginal symptoms. Can you get bacterial vaginosis, BV, from a sexual partner? The term, vaginosis, refers to a vaginal abnormality. Therefore a male cannot get bacterial vaginosis. However, female sex partners of women with bacterial vaginosis may want to consider being evaluated because it can spread to female partners. Is bacterial vaginosis contagious? Although bacterial vaginosis is not considered to be a contagious condition, the role of transmissibility of bacteria among individuals is not fully understood. Since having multiple or new sexual partners increases a woman's risk of developing bacterial vaginosis, this suggests that spread of bacteria among individuals may alter the balance of bacteria in the vagina and potentially predispose to development of bacterial vaginosis. However, since bacterial vaginosis also occurs in celibate women, other causative factors must also play a role in its development. It is not possible to contract bacterial vaginosis from toilet seats, swimming pools, or hot tubs, or from touching contaminated objects. Can bacterial vaginosis be prevented? Because the exact reasons for bacterial overgrowth in the vagina are unknown, it may not be always possible to prevent bacterial vaginosis. However, by practicing certain behaviors such as, don't smoke, avoid vaginal douching, and avoid having multiple sex partners, a woman can reduce her chances of developing the condition. Can bacterial vaginosis, BV, be treated and cured with home remedies? There are no home remedies or natural remedies for bacterial vaginosis. It is important to note that douching, rinsing the interior of the vagina, will not help with BV, and there is no proven medical benefit of douching. In fact, douching may flush bacteria farther up the genital tract into the uterus or fallopian tubes, potentially worsening the condition. Women with bacterial vaginosis are at increased risk for contracting HIV infection as well as other STDs including genital herpes, gonorrhea, and chlamydia. In pregnancy, bacterial vaginosis has been linked to premature labor, but the exact relationship is still not clear. BV has also been linked to miscarriages and other problems, so treatment during pregnancy is advised. Are you interested in the treatment of bacteria vaginosis? Chat me up on WhatsApp. +234 703 247 4726. Terms and conditions applies.